Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to be going over those of you with degenerative disc disease, herniated discs and bulging discs that are not in acute pain, how to squat heavy using a lever squat that changes the mechanics, sparing your lower back from stress. Hope you enjoy. So you'll notice with a lever squat, as I perform the exercise on a lever bench where the free weight is on a bar, but the bar has a pivot point behind me, as opposed to normal deadlifts and squats which have a more vertical compressive force on our discs that can aggravate degenerative discs, L5S1, L4-5, herniated and bulging discs. We're going to use a grip that is behind so that as I squat, my hand grip centers the force a little closer to my hip joint as opposed to out in front of me. That's going to spare my lower back. And with the weight slightly behind me, it's going to produce more of a horizontal stress on my spine and not a vertical compressive stress. So when I do this set in a moment, keep in mind that I'm going to be keeping my RPI and neutral spine on. That's unique for all of us. If you don't know what that is, go to the painfreeandfit.com website. We have a free body analysis, or consult with me online, or take any of our Pain Free and Fit healing exercise programs. They teach you how to position your spine so it's using the right position, avoiding the tendency to put yourself at risk by compressing your spine or irritating your discs or soft tissues with asymmetrical or hazardous stresses, and engaging your RPI, the muscle groups that are weak or inhibited in you. For me, I'm going to be engaging my left multifidus at L5. If you don't know what that is, we have that information again at many of our programs, or you can consult with me or go to the painfreeandfit.com website. We have a free body analysis to teach you that. I'm also going to be avoiding during this squat raising my left hip up and leaning my ribs into the left. I'm going to be keeping that side a little bit more open and checking, focusing on that during my set, that as I engage my core, that side resists its tendency to compress. Whatever your unique RPI neutral spine is, you need to focus on that. It may be a rotational situation with your hips that you need to hold your hips slightly torqued to one side of your rib cage. You may need to laterally translate your body, either at the torso or the hips. You may have to engage your transverse abdominis in a different way, using less oblique muscle on one side so that you're not compensating and introducing an asymmetrical force. The other thing to keep in mind is as I do this set, remember that I'm going to be jumping from a superset. I'm going to be doing leg extensions to fatigue first and then coming right into the superset. So hold on, here goes the set. Hope you enjoy. So if you notice, I kept a lot of focus on my core the entire time, emphasizing hip motion, glutes, thighs. My thighs, quads are already pre-exhausted from my pre-exhaustion set of leg extensions prior. I popped on over, hit 400 for 11 reps. Felt good in my legs, my glutes, fantastic core workout, lower body workout, sparing my back. If you'd like to check out more ways to save your degenerative discs, herniated discs, and bulging discs, check out our degenerative disc fast track program at painfreeandfit.com. It has a full body analysis to figure out your mechanics, your stability weaknesses, how to correct them, and how to step-by-step build a rehabilitative program. So despite your chronic disc condition, remember, we're not talking about doing this with acute pain, acute disc herniations, or bulges. We're talking about chronic situations that you've had for a long time that aren't currently majorly painful. Your pain hasn't increased with an acute injury, but you've built up your stability in your core step by step through like the fast track program, and you've graduated to be able to pop 400 for a set of 11 after pre-exhausting your quads. So you know the quads are shot. You're using those glutes, you're using those posterior chain muscles, the hams, to push the body more. And right now, my low back feels good. Great workout. Stability is the point. If you enjoy this video on lever squats with a posterior grip for degenerative discs, please subscribe to our channel. We got a lot of great videos out there. Questions and comments, write in. As always, I do my best to answer. And remember, check out our fast track program or consult with me online for a great program to get you and your back from its present state back to training heavy and feeling pain-free and fit.